In the past, we presented a blog where we talked about how effective gastric bypass surgery is to control symptoms of reflux. And in general, it is. It is probably the standard of care for the treatment of severe reflux in people with morbid obesity. We did receive a question from a patient who says that she's had gastric bypass to treat her severe reflux, and she reports that after operation her reflux is worse, and what's going on there. And the things that I think about when I hear this story is that there may be some things wrong with the bariatric operation. If the gastric pouch is too big, there are too many acid producing cells in there, and that can cause acid in the upper pouch and esophagus. If there is an unidentified or untreated hiatal hernia, which is a weak spot in the diaphragm where the esophagus comes through, where actually part of the stomach and part of the new stomach can actually be up in the chest, and that will need to be repaired. Is there an obstruction out of the out of the little pouch that's causing acid to back up there? That can be another cause. And second is occasionally patients say they have heartburn and reflux when actually there's something else going on that is related to the motility of the esophagus. So this certainly needs to be studied. X-ray barium swallow to look at the size of the upper gastric pouch. I study it with endoscopy. Working with a gastroenterologist to study the esophagus, do what's called manometry, which checks out how the esophagus muscles are working, and pH testing to see if it actually is acid getting up into the esophagus. So these things could be worked out, and there's probably something that's either misdiagnosed or anatomically can be made better to help you.